Hi, I'm Dr. Franco Gerard at Oaklands Dental in Victoria, British Columbia. Alright, so in this video we're going to talk about what to expect if you're considering getting an implant. The first thing to talk about is, what is an implant? An implant is a fixture that allows me to connect something to your jawbone. That could be an individual tooth if we're replacing one tooth, or it could be, if we're using more than one implant, to connect several teeth, or it could be something to stabilize a denture. There's other things, but this is what it is. And the first thing that you would do when you come in is we would get some records. We come in and we would get a 3D digital scan of the inside of your mouth, and we'd also use a cone beam CT to get 3D slices, an image of 3D slices of your bone inside, underneath your jaw. And what that allows me when I put those two images together is to end up with a 3D model of you inside and out. And that allows me to plan, let's say if I want this tooth to end up in this position, and I need to know, well, the implant needs to be underneath here so the forces are right. Is there enough bone there? And if there is, great. And if there isn't, what other procedures do I need to include to make that work well? The other thing that we use all this information for is to make something called a surgical guide. And what a surgical guide is when after I've done my planning, I get this guide that sits on the rest of your teeth or on your gum, and ahead of time I've decided what the orientation of the surgery is going to be, where I'm going to place the implant, in this orientation, and the depth. And that has two major advantages. Advantage number one, it's much more precise. Advantage number two, the procedure is much faster. And when procedures are faster, traditionally the recovery is much easier. So those are the two major advantages. After you get the procedure and the implants placed, usually you'll leave with something called a healing cap. So the implant itself ends up pretty close to your gum line. And then we put a little metal cap on top of it just to protect it. And we let that heal for a period of about 3 months. And that's usually how that happens, unless it's an anterior tooth, in which case sometimes if the bone is in a good enough position, we can put a temporary tooth on there that doesn't actually bite, but that's there for aesthetics. That's only in certain situations, certain circumstances, so we'd have to talk about that ahead of time. Thank you for watching this video. I'm Dr. Franco Gerard at Oaklands Dental in Victoria, BC. You can learn more at our website, oaklandsdental.ca.